for those of you that have played sports, practice makes perfect, and so every day that you come to work, you step up to the plate. And so we really wanted to focus on those ways that you can practice safely, the ways that you can orientate, train, and hopefully retain your staff members so you can provide high quality, safe care. So there's 3 learning objectives covered in this article. Once again, we bring back the importance of high reliability in pharmacy locations, and kind of look at those applications when it comes to ambulatory or inpatient locations. Number 2, like, how do you build your lineups? How do you hire? How do you train? How do you ensure that staff are competent before ever actually starting that job? And how do you maintain that competency over the duration of their employment? And then the last thing is really focus on prepare and practice. So, we've heard over the years, in sports that there's a lot of work behind the scenes that takes place to ensure that those teams perform at a high level. Even small routine plays are normally practiced hundreds or not thousands of times before they even take the field. And so this article is really focused on those aspects of what you do in the pharmacy. And so for those of you that are Joint Commission accredited, you might know this, that we are required to provide proof that staff receive orientation, training, and that competency is assessed for the duration of their time in the pharmacy. And so even if you're not accredited, I think it's important to look at those standards, and you can still apply them to your workplace. And think about, like, when's the last time that you've looked at your orientation program and your training program? Because one of the things that I recommend, and I recommend this in the article that you have, is that we should be building potential errors into orientation and training. If you're an expert pharmacy technician and you're training a new tech, you should know, the 5 or 10 errors that are most common, not only in your pharmacy, but also for a new employee in your pharmacy. And so to build those into your orientation program, and then making sure that you're covering those types of errors consistently will help not only improve staff performance, but hopefully improve the number of or reduce the number of errors that you might see in your area. And so, I said, once again, we cover preoccupation with failure, sensitivity to operations, the reluctance to simplify our interpretation of information, your commitment that you've made, the resiliency that you've shown over the past 3 years that's really helped you bounce back through some tough times. And then lastly, the most important principle when it comes to deferring to the experts, right? Understanding that as pharmacy technicians, we should be and we are considered experts in our field. And then lastly, we cover really how you address errors. So when you have an error in your pharmacy, how do you ensure if it was a people problem, or was it a process problem? Was it a poor policy? And so I talk about a decision tree that kind of was made famous by Dr. James Reason, that kind of helps you walk through, is it a person issue, a personnel issue, or is it a process, policy, program issue? The algorithm that's in the article is actually recommended by the Joint Commission as a way to ensure that you have a just culture. And then lastly, I cover one air prevention tool, and that's called task assistance. So one of the most important things you can do when you're hiring, training to ensure that you can retain your staff is to teach them air prevention tools. And so the air prevention tool covered in the article is called task assistance. And so what it means is that are your staff comfortable either seeking help when they're struggling or offering help when they see someone else struggling? And I really think those situations where you expect them to provide task assistance or seek task assistance can be and should be built into your orientation, training, and your competency assessment program. And so, I hope that you enjoy the article.